I want to give a special welcome to those joining from Boston, Chelsea, Somerville, Cambridge, Randolph, Milton, and Everett. I'm joined tonight by the incomparable. She'll be coming shortly. We've been in boats, so that's why we've had the delay. But my big sister, a source of strength and inspiration to so many of us, Representative Barbara Lee will be joining us at this table as well. She represents California's 13th congressional district and truly serves as a moral compass in the House. Congresswoman Lee is my sister in service, a mentor, a progressive champion for the people, and she is the only Black woman in Democratic leadership serving as co-chair of the Policy and Steering Committee. And she also serves on the powerful Budget and Appropriations Committee, which oversees all federal government spending. Additionally, we have Dr. Kendi here with us tonight, a world-renowned scholar in the study of anti-racism. Dr. Kendi is one of America's foremost historians. He is a National Book Award winner, New York Times #1 best-selling author of 7 books. He is also a professor and the founding director of the Boston University Center for Anti-Racist Research. I'm so proud that the Massachusetts 7th is your scholarly home. Thank you, both of you, for your continued partnership, and more importantly, thank you for your commitment to the work and the fight for racial justice. In the midst of this ongoing pandemic, this fight is more important than ever. COVID-19 has ravaged our nation, and as is always the case, people of color, Black folks, have been forced to shoulder the greatest burden. We know that Black folks specifically are more likely to contract, be hospitalized, and to die from the coronavirus. And with the deployment of COVID-19 vaccines, our community is less likely to have access due to vaccine redlining, misinformation, and racial disparities in life expectancy. Make no mistake about it, these health inequities did not begin with the pandemic. The coronavirus has merely unveiled and exacerbated the deeply rooted problems that already existed. For far too long, our federal government has failed to recognize and to address the structural racism that has devastated Black and Brown communities and denied access to quality health care. That is why Congresswoman Lee and I partnered with our partner in good, Senator Warren, to introduce the Anti-Racism in Public Health Act. We did that earlier this month. This is the first of its kind legislation. It recognizes a simple truth. The government will never be able to confront racial disparities until it confronts and actively dismantles systemic racism. Our legislation would expand federal research and investment into the public health impacts of structural racism and require the federal government to finally proactively develop anti-racist health policy and take a public health approach to combating police violence. The coronavirus right now is the 3rd leading cause of death for Black Americans, and police brutality, the 6th leading cause of death for a Black man. Yes, violence at the hands of law enforcement is a public health issue. Look no further than the stolen lives of Breonna Taylor, Sandra Bland, and in my district, Terrence Coleman and so many others, with studies concluding that police brutality, again, is the 6th cause of death for young Black men. It's time we treat police violence like the public health emergency that it is. The Anti-Racism in Public Health Act would create a national center for anti-racism at the CDC, as well as a law enforcement violence prevention program. The newly created center will be charged with declaring racism a public health crisis, which several municipalities in the Massachusetts 7th have declared, and provided dedicated resources to support local and state efforts to educate the public on and to advance anti-racist public health interventions. Now, the same way the CDC provides guidance to health officials and policymakers related to coronavirus, this legislation will require the CDC to publish and promote anti-racist policy, health policy. We'll finally have a robust, multidisciplinary, and race-conscious approach that acknowledges decisions on social determinants of health, like housing justice and transportation equity. I know in the city of Boston, it is Transportation Equity Day. These are major factors in public health outcomes. I represent one of the most diverse and unequal districts in our country. In a 3-mile radius, life expectancy in my district drops from 92 years in the Back Bay to 59 years in Roxbury, and median household income by $50,000. with people of color holding the short end of the stick. The infant mortality rate for Black babies in Boston is nearly 5 times higher than the rate for white babies, with infants born in Dorchester and Mattapan having a lower birth rate than other areas in the city. These statistics didn't happen by chance. None of these inequities or disparities or unjust outcomes are naturally occurring. Quite the opposite. This is policy violence. These inequities have been created by precise, draconian, short-sighted, and discriminatory policies. So we don't only need anti-racism in health policy, we must incorporate an anti-racist approach for all legislation, and it is possible to do so. For centuries, those in power have inflicted policy violence on communities of color. Black folks in particular have had a foisted hurt and harm onto them, legalized, legislated, very precise. And if we can legislate hurt and harm, then Dr. Kendi, I do believe that we can legislate equity, healing, and justice. And now is the time. All right, so finally, the moment you've all been waiting for, I just wanted to offer a frame for this discussion, but we really want to hear from you, Dr. Kendi, and we know that we're already coming to sit at this table late, given the legislative process, and so I would just love to hear from you, your top line thoughts, and then we'll get into it.
Sure. Well, first, let me just take this opportunity to thank you for allowing me to join this table. And of course, let me publicly wish you a belated happy birthday as well. And as you know, the unfortunate thing is there are many families, particularly families of color, who aren't able right now to wish their loved ones happy birthday as a result of their lives being taken from COVID-19 or even police violence. And I can remember at the end of March of last year, I continued to hear this idea that this new pandemic was the great equalizer. And I remember sitting down to write a piece for The Atlantic to basically ask the question, where's the racial data? And I remember while I was writing that piece, Congresswoman Ayanna Pressley, as well as Senator Warren, came out and asked the same sort of question. It was the first, sort of duo to start asking the American people, where's the racial data? By mid-April of last year, many states had finally released racial demographic data, and it became national news that Black and brown people were being infected and killed at higher rates. And instead of people realizing that this was the result of longstanding systemic racism, Americans almost reflexively responded by saying, well, what are Black people or brown people doing wrong? What's wrong with them? They're not socially distancing. They're not taking the coronavirus seriously. When indeed in March, a Pew Research study had already found that Black folks were actually taking the coronavirus twice as seriously as white folks. By the end of April, there were demonstrations across the country that were predominantly white in which people were demonstrating to reopen their state. So suddenly people couldn't make the case that Black folks and brown folks were not taking the coronavirus seriously. So then the explanation for these racial disparities switched to, well, it's because Black people have more pre-existing conditions, and they have more pre-existing conditions because they're lazy, because they don't eat right. Again, because there's something wrong with Black and brown people. But of course, by the summer, by the time we actually started conducting studies to really investigate the causes of these disparities, we began to see that it wasn't because there was something wrong with Black and brown and even indigenous people. And so that's why I'm so excited, about this Anti-Racism in Public Health Act, because we need to consistently and constantly, the federal government does need to be researching the causes, of racial disparities that are leading to the deaths of Black and brown and indigenous people. And when they started studying the reasons, they realized it was because Black folks had less access to health insurance. They realized it was because Black folks were more likely to live in neighborhoods with higher levels of air and water pollution, which were then causing those pre-existing conditions. They realized it was because Black folks were more likely to live in trauma deserts where they didn't have access to high quality healthcare. And they also, of course, realized that Black and even brown people were less able to work from home. And so if we would have, so ultimately it was racist policies. Ultimately, as Congressman Pressley stated, it was policy violence, this history of policy violence. And so obviously if the problem was policies, if the problem was racist policies, then thereby the solution was needed to be anti-racist policies. But I think for far too long, we have blamed Black and brown people for the causes of disparities and inequities, not realizing that when we're doing that, we're being racist. As opposed to recognizing that the problem is society, is conditions, is structures, is systems, is policies and procedures and practices. And when we recognize systemic racism as the problem, we're being anti-racist. And so, I'm glad, and again, I'm excited for this potential center within the federal government, because if people ask me, Congresswoman, all the time, what is the most sort of devastating sort of set of health or racial disparities, and I always go back to health disparities, because of course we're now facing these disparities for COVID-19, but even before COVID-19, Black folks and brown folks were dying at higher rates from heart disease and respiratory disease and cancer. And this is a large segment of people. And so, this is a serious problem. And without question, we should be recognizing that racism is a public health emergency.
Thank you, Dr. Kendi. And thank you for, first, I would love for you to, since you are to be anti-racist, you are the author of that. And so, I think language is so important, and very often people are likely using that and not operating with a full definition. So, this has gained popularity in recent years, but, certainly the work of anti-racism work began and existed long before. So if you would just do two things. One, if you could define what it is to be anti-racist, because I don't want to assume that people are all operating with the correct definition. And then secondly, are there any role models for you in this work who have demonstrated an anti-racism approach, specifically when it comes to policymaking, or it could be as an activist or organizer?
Sure. I define an anti-racist as someone who is expressing an idea of racial equality or supporting a policy that leads to racial equity and justice. And so to break down that definition, someone who connotes that this isn't a fixed category. No one becomes anti-racist. This is what we can strive to be based on what we're saying and doing. And it's fundamentally a doing. and so when we are expressing that there's nothing wrong with Indigenous people, or there's nothing right about white people, and we're thereby expressing the equality of the racial groups, despite any sort of cultural or phenotypic differences, we're being anti-racist. When we're supporting policies that have been proven to reduce or eliminate disparities and inequities, we're being anti-racist. When we're using our power, when we're using our platform, when we're using what we have to this larger struggle for racial justice, we're being anti-racist. And I think the person who there's so many people that I admire, but one person that comes to mind is actually someone who said in the late 1970s that it's not enough to be not racist, we must be anti-racist. And I'm talking about Angela Y. Davis. And I think the reason why I'd emphasize her is because throughout her career, while even other folks of color were condemning incarcerated Black folks, or incarcerated folks were even degrading poor folks, and even poor Black and brown folks, or were degrading Black teenage mothers, were we're degrading, Black queer community. She, throughout her career, we're defending them. She was stating months before the crime bill was passed, this is going to be a problem. She was stating in the 1980s when people were claiming that there was this broken Black family, that this was a problem. She was stating in the 1970s that we have a growing problem of mass incarceration.
That's right. And so, I find that whenever we offer we enumerate these devastating facts and I offer these sobering statistics, sometimes I feel like people are glazing over and I say, well, if you're tired of hearing me recite these statistics, imagine what it is to be living them.
Exactly.
And so we do have both a responsibility and I do think an opportunity in this moment. And certainly I seek to legislate in a way that is, precise and prescriptive and that addresses the disproportionate hurt and harm that has been legalized and legislated against Black Americans in all marginalized communities. Like this Anti-Racism and Public Health Act, like my bill to abolish the federal death penalty, our Healthy Mommies Act to combat the maternal mortality crisis, our baby bonds bill to create a seed account that would allow us to create an ecosystem whereby our children can really thrive because this seed account would accrue and allow them to begin to build wealth when there have been so many other policies like redlining that have stood in the way of that. My legislation to cancel student debt. We know that 85% of Black students have no choice but to borrow, and they're 5 times more likely to default, right? So, as a scholar, as an academic, are there any other prescriptive policies, as we find ourselves at this inflection point as a nation? Because I certainly don't want us to recover to a pre-COVID, insufficient, unjust status quo normal. Reverend Barber says this is a moment of reckoning that demands a reconstruction. So could you give us some pointed areas around that we can organize around and mobilize around that get us to that third reconstruction, that policies that you endorse, that you think would make great strides in being anti-racist?
So I think I remember, and please correct me if I'm wrong, that after you were elected and there was a bill put forward to really restore voting rights, that one of the things that I believe you advocated for was lowering the voting age.
Yes.
And to 16, if I'm correct.
You're right, and that's HR 1. And
Yes.
I cannot believe you were even paying attention to that. And Dr. Kendi, can I tell you, and we see my big sister here, Representative Lee, only Black woman who's at the leadership table, is joining us after doing the people's business on the floor. I'm going to give you a second to collect yourself, Congresswoman. I was just asking Dr. Kendi about his recommendations for policies that are actively anti-racist and what we should be seeking to advance in this moment. And he was bringing up my amendment to HR 1 to lower the voting age to 16 in federal elections. Dr. Kendi, I was shocked by how polarizing an issue this was. And when I would tell people, well, listen, John Lewis is an original co-sponsor of this. Our young people deserve to have a stakeholder in our democracy. But talk to me about why you believe that that's anti-racist.
Well, I mean, when you look at younger people and when you look at younger voters, one of the areas in which we've talked quite a bit in terms of Black and brown folks being disenfranchised, but young Black and brown folks in particular are facing the brunt of disenfranchisement. And when you have when the sort of younger generations are more predominantly Black and brown, it sort of leads to a greater level of disenfranchisement. So anything that can ensure that younger people can vote, the younger the better, is going to then allow more Black and brown folks to vote, and thereby bring a greater sort of sense of multiracial democracy to this country. Secondly, I would state that we've spent a lot of time praising, as we should, the Brown v. Board of Education decision 1954, of course, that desegregated schools. But there was a case, I believe that came out of San Antonio in 1967 that essentially allowed for local property taxes to continue to fund schools. And that has maintained massive disparities in school funding. And so by figuring out ways to close those resource gaps so that we won't continue to have a nation where kids who have the least in their homes will also have the least in their schools could also, I think, make drastic sort of progress as it relates to racial equity. But I can go on and on. Let me just
No,
name
but I
those two.
appreciate your lifting, those two in particular, because they certainly do demonstrate how our communities, and if you layer that with the undercounting historically of the census, our communities have been historically under-resourced. And then you have an ecosystem whereby people can't thrive. They're forced to do survival behavior. And then that behavior is criminalized, resulting in the communities that are the most under-resourced being the most surveyed, profiled, and criminalized. So, okay, we have Representative Lee, I'm gonna bring you in here. We were talking about our Anti-Racism and Public Health Act. And of course, we know that systemic and structural racism persists across all systems. It's not limited to healthcare, but that's what we've been talking about. And so the floor is yours. I know we've got Dr. Kendi for a couple of more minutes here. So, the floor is yours, Representative. And if you want to talk about our bill or anything else.
Well, so I tell you, Dr. Kendi, thank you. It's so good to meet you. And congratulations on the work you're doing, because anti-racism has been misunderstood. Now you're giving everyone a way to navigate what anti-racism really is, but how we address it. And to my sister, Ayanna Pressley, it's good to see you, and happy belated birthday again.
Thank you.
And I just want to thank you for your tremendous leadership and inviting me to be with you. And anti-racist policies, Congresswoman Pressley knows so well, and I'm going to cite a couple of them. One is the Hyde Amendment as it relates to healthcare. Now, the Hyde Amendment is a racist policy, and I've said this since it was enacted in the mid-70s. Thank God Congresswoman Pressley heads our abortion task force now of the pro-choice caucus, because what has happened over the years, which we knew way back then, is that denying access to funding for a full range of reproductive health care, including abortion care, would severely impact African-American women and women of color, and it has. And so it's racist. So we have to have a policy that's anti-racist, which means we have to repeal that so that Black women, low-income women, women of color have access to the same type of abortion access that white women have, and women with money. And so that's one example. Another is the whole cannabis policy. I don't know if you talked about marijuana.
No, I'm so glad, because actually you're reading my mind, because you are my big sister and my mentor. And that's going to be a perfect segue for Dr. Kendi after you cue this up, is that I wanted to, since I said that our communities are historically under-resourced, and then, ecosystems where people are not thriving, but doing things to survive, and then are surveyed, profiled, criminalized. How do we need to be anti-racist when it comes to the radical reimagining of our criminal legal system? I've already spoken about my bill to abolish the federal death penalty, and thank you for your support on that. But please talk about cannabis justice. And then I would love to hear from Dr. Kendi, what does being anti-racist to you look like? What should we be striving for as lawmakers and justice seekers for those that are joining us online? So
well, the war on drugs was the central aspect and central theme of the war on drugs, we know, was racist. And so we've got to unpack that. One is, we know that African Americans have been disproportionately incarcerated and are charged with marijuana crimes, marijuana charges, which are first, they're unjust laws. They're racist laws. They're charged with them. They either go to jail and or have this on their record. which prevents them, of course, from getting a job, Pell Grants, food stamps, public housing,
That's right.
moving forward in their lives. So it's a big deal. It's a racist policy. So we have to unpack that and unravel it, which means we have to have some justice in our laws. And so I introduced the Marijuana Justice Act many years ago. I co-chair the Cannabis Caucus. First time anyone Black, first time a woman, first time a Black woman has co-chaired it, bipartisan, and it's all white guys, right? And so I had to get in there and say, look, these policies, you got to deal with anti-racist policies in our criminal justice system, specifically marijuana offenses. So we introduced with Cory Booker and of course my sister Ayanna Pressley, the Marijuana Justice Act, which was embedded in and included in the MORE Act, which we passed. But we have to do that because we have to expunge the record. So there's a pathway to making these laws just, but we can't just say we're gonna deschedule marijuana and keep the feds from vamping on states and keep the states from arresting people. We have to say, no, we've got to have restorative justice. We've got to expunge the records and we've got to put resources into real restorative justice, which means whatever, education, workforce training, healthcare, housing, everything to help repair the damage of these racist policies. So we're working right now on an anti-racist policy, which would mean we have to pass and the Marijuana Justice Act for some justice. So I'll stop there. And
no, that was excellent. And in fact, Congresswoman, I'd asked Dr. Kendi, who's someone who is a role model of anti-racism advocacy and policy championing. And he brought into the room Angela Y. Davis, who was outspoken about the 94 crime bill.
And she's my constituent, incidentally. I just want you to know that.
Well, what do you say, right? You represent the wokest district
in the
Oakland
world.
Okay, in the world. And of course, she predicted, what would be the fallout and the impact of that 94 crime bill. Right. And so, Dr. Kendi, I would love to hear your thoughts on our criminal legal system or anything else that you would love to. We're grateful for your wisdom.
And I think one of the things that happened in the 1970s in particular, if not in the late 1960s, was those who were really opposed to a just and equitable America were able to redefine a racist policy. In other words, they were able to claim a policy like affirmative action was racist based on this idea that a policy, it doesn't matter the impact. From their standpoint, if a policy has racial language in it, it's quote racist. And if it doesn't have racial language in it, it's quote race neutral and colorblind, and so therefore American. And so as a result, in many ways, our courts and even in popular imagination, people have been looking for intention and racial language to determine whether a policy is racist, and not the outcome of the war on drugs and its series of policies, not the outcome, of voter ID laws, of purging of voters. And I think if we were to focus on outcomes, if we were to say plainly, if a policy is leading to or maintaining racial inequity and disparity, it's racist. And if a policy is reducing racial inequity or creating equity, it's anti-racist. I think that would simplify a lot, right? But of course, it's hard to prove the intention. It's very easy to prove the outcome. And the outcomes of our policies are plain as day for our people.
Thank you, Dr. Kendi. Well, you have been so nimble in working with us this evening, and we're grateful just for your being a pace setter, in this space, and a steadfast champion and a teacher to all of us. And so, thank you for lifting up, those specific bills that we should continue to work to advance. And congratulations on this very exciting season for you. And we know that this will not be our last time together. So this will be an ongoing dialogue and ongoing work. And we know that you have to get going. I think we have you for one more minute. So if there are any closing remarks or anything that you would like to share.
Well, let me just say, I mean, as someone who is uh, trying to encourage the American people to recognize that the problem are these bad policies, you know, as opposed to these so-called problematic people. Um, there's a constant sort of asking of me to indeed point out examples of people who are focused on policies and who don't think there's something wrong with people. And so I'm able to actually share with them that there have been champions who've been saying this for decades, like Congresswoman, you know, Barbara Lee, and I'm able to speak about you, Congresswoman Pressley, and so I'm just, you know, what you do on a daily basis makes my job so much easier because I'm able to sort of lift you up as examples of how to be anti-racist.
No, well,
Dr. Kendi, can I just say
yeah,
something? And I want to
yeah.
thank you for those
Tell
generous
us.
comments, but let me tell you, uh, people don't know what being anti-racist is, and you're really defining it for the first time for so many in this country. And as I thought about tonight, and this is Black History Month, I couldn't help but think about Malcolm X, who really understood what anti-racism was and structural racism. And we don't talk about him enough in context of Black History Month and how he is so current today. And I would urge you, if you haven't seen A Night in Miami, it's really a remarkable film to watch. But I'm thinking of him tonight because you reflect so much of his work, and I know he would be proud of what you're doing.
Absolutely, absolutely. The
Well,
ancestors are walking with you, and every time you speak, you fortify and embolden us in this work. You elevate our consciousness. You give us a call to action, and we're grateful for you. And Congresswoman, thank you for bringing Brother Malcolm into the space, because Boston takes special claim to Brother Malcolm, Dale Street, fortified in Roxbury. So thank you for bringing him in, and Dr. Kendi. So Congresswoman, you and I are going to sit at this virtual table for a couple of more minutes, and we're going to allow Dr. Kendi to go on to his next commitment. But thank you so much for joining us at this virtual table and building community with us for such a time as this.
You're welcome. Thank you so much. Y'all take care. Have a good night.
Bye-bye.
All right.
God, he's remarkable.
I mean, oh my goodness. Yeah. Well, I hope we'll have an opportunity to do this again, but we still have a number of people that have tuned in because they want to hear from you. And so I just wanted to, and I've already, spoke with folks about our Anti-Racism and Public Health Act and sort of enumerated the tenets of that. Thank you for bringing cannabis justice and your legislation and how that's embedded within the MORE Act to this discussion. Thank Dr. Kendi for bringing up voting rights and also the state of public education and how that's linked to property taxes and why we're not getting the same investment in our communities. I like action items and data points, so, policy is my love language, and anti-racist policy and pro-Black legislation is definitely my love language. And so to have the both of you being so pointed is very helpful. Let's talk about the environment. I'd be curious as to, how do you think, I'm going to call her Barbara because this is my sister, this is my big sister.
Please do.
And that's been since I was on the city council. You brought up the Hyde Amendment, and we've been partnering and doing the work of how to support our brothers and sisters behind the wall, women in particular who are often overlooked in the school to confinement pathway. Thank you for your support of my End Pushout Act legislation, my counseling not criminalization bill. But you and I have been doing this work together since before I was in Congress. And so I so appreciate your bringing up the need to repeal Hyde. But, we know that we need anti-racism policy across all issues and the comorbidities of structural racism and how that has shown up in this pandemic. Not having clean water, not having breathable air, the highest asthma rates. How do you think that we can be anti-racist? What's the intersectionality of climate justice and racial justice?
Sure, and that's so important, Ayanna, at this point in the intersection of these issues right now. And let me just give you a story about my why I have been so involved. You may not know this, in the environmental movement for so long, trying to get the environmental movement to embrace environmental justice and understand what environmental racism is. I was born and raised in El Paso, Texas, and small Black population, maybe 2%. We lived in a neighborhood where we had a lot of Latinx individuals living on the next street, and Black people on my street. And there was a smelter that was sited a couple of, probably a mile away. And so this smoke would come up every day, the pollutants from this toxic smelter. And fast forward, that's what I lived under. And my grandfather had severe lung problems. My mother ended up with COPD. My sister has MS. Young people that I grew up with who are my age now, they're probably 65, 70% of them are dead, okay? And finally, it's the Orozco smelter plant. Finally, there were lawsuits filed. NPR did an expose, and all of this happened as a child when I was growing up. And so the impact of that now is all of the disease and sicknesses in my family, my friends' family, can be traced right to that darn smelter. So I got involved, and I was a Girl Scout, Brownie, the whole bit. So I always cared about the environment. So when I, after college, got really involved with Ron Dellums and the environmental movement, I started looking at environmental racism and how these toxic sites are located in our community, how companies come in without even any community involvement and land in our communities, how we end up paying the price because of the public health consequences of pollutants and environmental toxins and what have you. And so at this point, we have to, in terms of the environmental movement, and we've been pushing this, and I think we're making a lot of progress now. The environmental movement has got to embrace environmental justice, environmental equity, and its impact on, and the impacts on vulnerable people and in low income and poor communities, because we die disproportionately because of what these corporations and what the federal government has not done. Look at Cancer Alley. I mean, has not done because we're Black and we die because of this. And so that's another racist policy that's built, that it may be so subtle, but it's very racist. And so we've got to develop anti-racist policies in the climate movement and in the environmental movement. And that's one of the reasons that the Green New Deal is so cool, because it does embrace that. Also, when you look at COVID, that was one other issue I wanted to raise, because we have to look at how Black people are disproportionately impacted by the transmission of the virus, by dying as a result of coronavirus, and now by being left out of the vaccine distribution.
Well, I'm calling that vaccine redlining.
That's what it is. That's what it is. And it is so bad, because we thought that we would at least figure out how to fix it, but no, it's getting worse. And so we have our bill, the COVID, which you have helped put together, the COVID Community Care Act, which really disrupts a lot of the systems right now, the healthcare system, which are based on racism, of course, and provides for targeted funding and resources for nonprofits, community-based organizations, and hiring our local messengers to be trained with public health messages to deliver to people. And in terms of the vaccine, how we get that out and distribute it fairly. So once again, we've got a new pandemic. Now we see the racism based on historical racism of the last 401 years that's come to light in our healthcare system, and we're still dying from the pandemic in disproportionate numbers after 401 years of trying to liberate ourselves from racism.
You know, would you mind speaking? You're exactly right. And, you know, recently, Senator Warren, Senator Markey, and I sent a letter to the Department of Health and Human Services, consistent with the work, Congresswoman, that you and I initiated at the outset of the pandemic to mandate the collection of racial data, right? We knew anecdotally, because everything hits our communities harder, but you know, we had seen it with H1N1. We knew because of the comorbidities of structural racism, unequal access to healthcare, we could predict how this was going to play out. So early on, we were banging the drum and saying, we need to collect this data, because they were only collecting age and gender. And we said, look, we need race. We need that racial data. And so, of course, once that was mandated, we were seeing just sobering, devastating disparities that were being reported in real time, which then gave us the leverage to course correct in real time. Because why do we need data? To inform how resources are coordinated, invested, and marshaled, right? And so now we need to do the same thing when it comes to the vaccine. That which gets measured gets done. But it is just so frustrating and such a damning commentary on systemic and structural racism that we have to suffer great loss of life and injury and trauma in order to make the case. This should be just as much about prevention and mitigating the hurt as it is stopping it from happening in the first place, as it is intervention. So,
but you know what? The Anti-Racism in Public Health Act, Ayanna, is just so important. It is so important. I was really proud to support this with you and Senator Warren, because this gets right to the core of what we're talking about in healthcare, because we've got to disrupt and unpack all of these racist systems in public health by establishing these offices and having equity and as a part of how we build a new healthcare system. Otherwise, we're going to keep on this downward spiral. But one data point that is so important, and thank goodness for the Biden-Harris administration who get it in terms of data, because the Trump administration, we even wrote it with you into the bills, and they just, into the legislation, the HEROES Act, the CARES Act, CDC never even did it. So now, thank goodness, we hope that we'll get that data. But one data point that is just shocking to me is that in some communities, okay, now check this, you would never think that this is a racist policy. 65 and under are eligible for the vaccine. Okay, remember that. The lifespan of African-American men, the average lifespan is 68 years. Okay, so what does that say about who gets the vaccine just with African-American men? I mean, is that racist? Actually, they don't know it.
I can sadly do you one worse than that. And I lifted the statistic at the top in my opening remarks. In the district that I represent, the Massachusetts 7th, Congresswoman, is a 30-year life expectancy disparity from the Back Bay to Roxbury of 92 years. So Back Bay is an affluent, mostly white community, to Roxbury, which is the blackest part of my district. And the life expectancy, I think, is 59 years. I'll double check that in a moment, but it's just damning. And when the work that we do on the maternal mortality crisis and the disparate impact that has on Black women, so often when I'm talking about that, people will, someone in the healthcare community or a doctor will say, "Are you saying I'm racist?" I don't know if that's something that you've ever had to respond to, but it's like, what we're saying is that this is systemic and this is structural, right?
They always say, "Oh, you're playing the race card," and we talk and let's get to Truth Commission and reparations, and we're not talking about individuals. We're talking about a system, a structure that has precluded and discriminated against people for generations, for hundreds of years. And so, folks don't need to get defensive. That's why truth telling and Day of Reckoning has got to happen through our Truth Commission, through reparations.
Let's talk about that, because I want everyone to understand that this is not a matter of or. In this moment, it's about and. We're pushing all of it. Repeal, hide, cancel student debt, the Anti-Racism in Public Health Act, cannabis justice, we're talking about all of it. The Green New Deal, it's not or, it's and, because we're talking about intersectional legislated oppression and marginalization across every system.
Right.
So we have to be actively anti-racist in every issue, from transportation to climate justice, to housing policies, to education, to our criminal legal system, to healthcare. But since people are seeing us here in Washington, Congresswoman, having this fight around accountability after an insurrection, right? And we can't believe we even have to fight that fight. Please talk about the merits of truth and reconciliation and why that is necessary. Well, I know
some people don't call
it right. So listen, I know I pay attention. So, but go on and educate the masses.
some people don't believe we have to fight that fight, but as Black people, we know white supremacy and domestic terrorism has been part of our lives. And so this attempted coup, this insurrection, I wore tennis shoes that day because I had been reading the websites. I've been listening to Donald Trump for the last 5 years. I knew something was gonna go down. I didn't know what, but you just put two and two together as a Black person, you know, go hit the fan. So, so it's important that we look at and what a Truth, Racial Healing Transformation Commission does. Is what 40 countries have done forever. We actually fund the United States Institute of Peace, fund the technical assistance to establish commissions around the world where genocide has occurred, slavery, crimes against humanity, because you can't get past these atrocities until you have that day of reckoning where people who have been impacted and affected are able to come forth, talk about the impact, educate the public, and then move on. And transformation, of course, for African Americans, that's reparations. That's repairing the damage of the last 401 years.
I want to make
it's
sure
reparations, but it's reparations. But let me tell you, a lot of, and I have to just say, a lot of my white progressive constituents, once Mr. Floyd once he was murdered, and everyone saw this, once the COVID pandemic hit and they were seeing all these Black people dying and getting the virus, they were calling me up saying, what is going on in this country? Why? I'm saying, wait a minute. Don't you understand systemic racism? And I had to put it all together for them, right? I said, and this stems from the first enslaved Africans being brought to these shores 401 years ago. So I had to walk them through, and these are enlightened people, good people. I had to walk them through that. Okay, fast forward to why this Truth Commission is so important, because the majority of the public, either they don't believe us, I don't think they know, and they don't know how systemic racist policies are connected to slavery.
But also, Congresswoman, you know, given the role that you play for us with the United Nations, if you want to talk about that as well, what has happened in other countries?
Sure, and in other countries,
talk about that.
and yeah, and you know, I love the United Nations. I've been the Democratic representative to the UN for 4 terms now, and it's just a phenomenal place. That's our hope, really. And speaking of Brother Malcolm, you know, he went to the UN and wanted us to establish an office for Black Americans at the United Nations, and we have, and we'll talk about that in another session. But we have our office there through the Congressional Black Caucus Institute now. But I think the United Nations provides a vehicle for global peace and security. It provides a vehicle for us to work on global issues. For example, the Sustainable Development Goals, end poverty, right? Clean water, right? Universal health care, agricultural development, making sure small farmers have access to what they need to plant and sell their crop. The Sustainable Development Goals are, hey, you can look at those and embrace them here in our own communities. And so Black people in America have to be connected to the global struggle for justice. And the Sustainable Development Goals need to be applied. And I have a resolution, actually, we introduced last time to embrace those here in the United States. And so it's very important that we work with our international bodies. And I'm so proud, I chair the subcommittee on state and foreign operations, which funds the United Nations, funds all of our international development and diplomacy initiatives all around the world. And so Black people have got to be involved in this effort.
I really appreciate your making that point, because the work of liberation and of the work of emancipation of all marginalized and oppressed folks, and Black folks in particular, you know, is not uniquely defined by the United States of America. There is global oppression, and you know, I know we have to wrap this up. I just wonder if there's anything that you might want to say about our immigration policies, because this is a debate that I'm having with folks all the time. And, you know, I represent a district that has a large percentage of Black immigrants who are being disproportionately deported right now. So I just wanted to lift that up, since we're talking about the ways in which oppression and marginalization are intersectional and global. Is there anything that you want to offer on that? And then we'll close out.
And I come from a wonderful immigrant community also, and have many African immigrants in my district. Haitian immigrants. Temporary protective status, we know, has got to be extended. And we know the immigration policies and the type of numbers that are allowed, the quotas from countries. And then you look at African and Black countries, Caribbean countries, African countries, the quota is always a lot less. Then you look at the requirements for entry into America. I'm talking about pre-Trump. It's been crazy during Trump time. But I mean, it's always been a biased, racist immigration system. So we have a chance now with this new immigration reform effort, comprehensive immigration reform, not to leave Black immigrants out. And so we have our task force, Congresswoman Yvette Clarke, yourself, myself, Karen Bass, we all have been working to make sure that Black immigrants from our motherland and from countries around the world where descendants of Africa come from, that they're treated fairly in our immigration system. And that means immigrants from Haiti, that means immigrants from the DR, Black immigrants who are, again, treated disproportionately bad in terms of the policies. And so we have to really see that there's racism in the immigration system and speak out and fight. We went down to the border in San Diego to talk to the Cameroonian immigrants who caught flights into, I think, Ecuador and then walked to Tijuana, Mexico, and all the way to the border, and they are treated all immigrants are treated poorly by our country. But in Mexico, they were treated even twice as right. What was happening with them was twice as bad as for other immigrants. So it's a worldwide problem, and we have to see it as a worldwide problem. And in any immigration policy, we as members of Congress have to be sure that Black immigrants are treated fairly.
Thank you. Thank you so much. I'm telling you, every time I listen to you, it is like a mini TED Talk or a master class in the work of racial and social justice. And I just appreciate you so very much. Oh. And, I hope that the masses will be able to see your documentary very soon.
Oh, yeah, that's tomorrow night, huh?
Yeah.
There's one tomorrow night.
Yeah. Well, I'll share information about that on our platform. Yeah. But I'm gonna close this out now. I'll have the final word.
Well, you were a star in that movie, though. I want you to know.
Listen,
it was have to say that.
To be a validator of your legacy that I have, been a beneficiary of, and to have the honor to serve in Congress with you and to legislate with you has been one of the greatest honors of my life, truly. So I'm gonna close this out. Is there anything that you want to say before I do that?
Well, I hope everyone understands that Congresswoman Pressley has, I got to just say, she hit the ground running when she came to Congress, and she reminded us that we can't wait, we don't wait, and we're moving ahead for justice. And so I have a chance to be with her in a lot of these meetings. And it's kind of like, I'm here, and this is what we're going to do, and we need to do it now. And we do it.
Oh my goodness, no. What I say is I go in the meeting and I say, Barbara Lee speaks for me. And she gives us the marching orders. Okay, but I'm gonna close this out. Thank you, everyone. I know we started late because of votes and we ran a little long, but I wanna thank Dr. Kendi for joining us. I wanna thank Congresswoman Lee for joining us. And I'll just close in saying this: race neutrality in policymaking is a myth. It serves to distract and to redirect your attention away from the white supremacy that is deeply embedded in the process. Now, many of you know this quote from Bishop Desmond Tutu: if you are neutral in situations of injustice, you have chosen the side of the oppressor. There is no such thing as neutrality in the struggle for justice. That is simply choosing the status quo. And in this moment of reckoning, we simply cannot go back to business as usual. So we enlist all of you as activists and movement builders and community builders in this reconstruction. The truth of the matter is, with any legislative process, Congress will take the credit, but progress will be made not because of the conviction of elected officials, but because of the courage of everyday activists and people like all of you. The power of the people has always been greater than the people in power. Right. And we certainly proved that in the most decisive of ways with this most recent election. The most marginalized met the moment. And now we must do the work of meeting the needs of those in the movement. And so I'm grateful to each and every one of you It's my honor to be in this struggle alongside you. And I just want to close by saying, please remember to be kind to yourselves. Nurture your spirit. Be as radical and bold in the work of liberation, and equally as radical and bold in Black joy and healing.
Yes.
The reason why we continue to experience indignities and is because we've been dehumanized. And so Black joy is essential, that it be on display, that it be preserved, because that's about showing our full humanity. So as bold and as radical to get to the systemic injustices as we are being, let's be equally as radical and bold in our healing and in our joy.
So I just have to say one thing. You said dehumanize and traumatize, and trauma-informed care is also so important as we look out for ourselves and for each other.
Yes,
okay?
It is. And that's going to be so critical to this recovery. So
that's right.
Thank you all for joining.
Okay. The daughter of a preacher, right? The granddaughter of a preacher. And that spirit and that preaching and teaching has changed the course of history here in the United States. So thank you so much.
Thank you, everyone.
Good to be with you.
We'll be back. Thank you.
Bye-bye.